Hi, this is Stephanie from Dallas. So today I thought I'd talk a little bit about how lack of recovery leads to injuries. And we're going to talk a little bit about two kind of different scenarios, people that are really sedentary and how it works that way, as well as people that are really active. And so let's go with the sedentary population first. So when people come into my office, a lot of times and when I ask them, well, how did you injure yourself? They can't really tell me. They're like, I don't know. I just started hurting one day. I'm not really sure what I did. And so this is where we look at recovery and lack thereof and how it's leading to some of the injuries. So let's take someone that is inactive. A lot of us have sitting jobs and we're, working at the computer 8 hours a day or longer. And what happens when we're in that sitting position? A lot of times we're not in that normal resting position of where we should be for the spine. We actually are sitting slouched or looking over a computer. And when we do that, we're in those positions for long periods of time. When we get out of that position, our body actually has to recover because it's not in its normal resting position. And then if it doesn't fully recover and we go back into that position, and it doesn't fully recover and we go back into that position, that leads to injuries and that leads to pain. And so one of the big things that we need to do is just make sure that we are sitting in a better posture so that we can have our spine in a better position. And there's other things that we can do, getting up every couple of hours, walking around, so that we can just normalize our spine and keep it in a better position. So that's one thing on how recovery or lack thereof can create problems with the sedentary population. But what about people that are really active? So when you're active and you're doing something, you're going to the gym, you're working out, you have to recover from those workouts. And if you overload the tissue, then you start having problems. And there's a lot of different reasons on why we overload the tissue. It could be that, you've had a really stressful week that week and your body's just more fatigued and you're trying to push it and it can't do it that week. Maybe it's that you're training too hard. Maybe it's, with runners that you're running and you are not changing your shoes out frequently enough. So there's a lot of different reasons that go into play. There's also a big reason on diet, and we'll talk a little bit about that, on how if we don't have a very good diet, how that also leads to our body not recovering quick enough between exercises that we do. So if you take an exercise and you're overloading that tissue, what ends up happening, so let's say it's a joint and you're overloading your knee joint and it's not recovering between bouts. That's how your knees become more degenerative, because you're not recovering between what you're doing. Or maybe it's a tendon and you're overloading that muscle and it's overloading the tendon, and that leads to a tendonitis or a tendinopathy. And a lot of it is because from exercise to exercise to exercise, your body's not recovering between the bouts and it's overloading that tissue and it's creating problems, and it creates degenerative changes within those tendons, within those joints, those kind of things. So one of the things that we'll talk about today will be from a nutritional standpoint, but next week we'll do a part 2 and we'll talk about it from a physical therapy standpoint, some things that we need to do in order for this not to happen. But a lot of the things that I talked about before, and I love the car analogy, and I know I go over this over and over again, but it so makes sense. A lot of us really focus on the calories and carbs or protein or not having the sugar or whatever the case may be. That's what we're focusing on. That's like the gas. That's the macronutrition that gets us from point A to point B. But what we don't focus on are the micronutrition, and that is the vitamins, the minerals, the phytonutrients. And so the oil, it doesn't matter how much gas we put in, if you just do not change your oil and you put in bad oil, it doesn't matter how much gas you put in, the engine is not going to work. It's going to break down. And so the oil for us is the micronutrition, and that's what we get from plants. And so a lot of us, we're just not eating enough plants for the activity, for the recovery, and that's what we really need to focus on. So one of the things when I talk to my patients about is just getting more plants into their diet. And some of them, I put them on a 10-day program where they're literally like shredding the bad stuff and really adding more nutrition, more plants into their diet. And one of the big things that they see is that, wow, when I work out, my recovery is a lot faster. I can actually push my body and not be sore for 2 and 3 days afterwards. I can actually go into another workout. And so these are nutrition has a big play into recovery, especially as we get older. So if we still want to push our body as hard as we used to push it when we were younger, we need to make sure that our diet is really good. And it's all about plants, eating more plants. And you can get a lot of your protein from that. That's a big myth. So one of the things that I suggest my patients is just upping their their fruit and vegetable intake, adding more shakes, those kind of things. So next week, we'll talk a little bit about, from a physical therapy standpoint, what we need to do to help with some of these injuries that we get, because they are very stubborn and they're very frustrating, and I see them all the time, and it takes a little bit of time to go through them and to get them better, but they do get better, and they get better with physical therapy. So anyway, I hope you guys have a great day. Let me know if you have any questions on anything. Feel free to forward this to anyone, and I will see you guys next week.